What could I have done better? Good morning, everybody. Today is Sunday, the 17th of October 2021. My name is Reverend David Ibiayo, and these are my thoughts. As the doctor did his ward round in the hospital, he got to meet many patients. Some were very happy because they were waiting to be discharged. Some were in severe pain and needed some pain relief. Some were anxious and fearful about their condition. Some just lay in bed without saying a word. And there was one particular patient in a coma, while others had different conditions. After his ward round, the doctor had a word with the nurses and made mention of two particular patients that complained about the nurses, that they never came on time to check on them when they pressed the buzzer calling for help. The nurses are always very professional and do their best for the patients, but the two patients that complained about the nurses had pushed the patience of the nurses to the limit, to the extent that when they pressed their buzzer calling for help, the nurses were never in a hurry to attend to them, but they took their time. The doctor was surprised to hear about the attitude of the nurses towards these two patients, because he knew his nurses were caring and would go out of their way for the patients. He knew this because he had worked with them for over 10 years and he could vouch for them. He then wondered why things were different with these two patients. One of the nurses then told the doctor that they had been pushed to the limit with the two patients. Another doctor then joined the conversation, so the nurse had to mention the names of the patients so that the second doctor knew whom she was referring to. She said the names of the two difficult patients were Mr. Nasty and Mrs. Unpleasant. She then narrated the kind of things that they did that was off-putting. She mentioned how both of them had a habit of spitting on nurses when they were not happy. She also mentioned how they both used to curse and how they have pulled the hair of nurses when they were being attended to. And she went on to describe their other nasty and unpleasant attitude. Both doctors then wondered why they had allowed that kind of behavior to persist. The nurse said that despite the nasty and unpleasant attitude of both of them, they still tried to give them the best care, but that it got to a point that they felt they could not deal with it again and had to avoid Mr. Nasty and Mrs. Unpleasant as best as they could and limit their time with them. Well, the story is not just about unpleasant and nasty patients putting off nurses, but it is about how friends have put off their friends because of their attitude, how husbands have put off their wives because of their attitude, how wives have put off their husbands because of their attitude, and how people in different kind of relationships have put off others because of their attitude. The truth of the matter is this: there's a limit to what people can put up with. As Mr. Nasty and Mrs. Unpleasant were told that they will be moving them to a different ward because of their attitude, they pleaded with the doctor to please keep them and that they lacked the care of the nurses, but it was too late. They both then thought of the following question: what could I have done better? We read the following in Proverbs chapter 9 verse 12. If you are wise, your wisdom will reward you. If you are a mocker, you alone will suffer. Take care, keep safe, and remain blessed.